Common questions that are asked. Can I do this on Medicaid? The answer is yes. You just don't make as much money. What states can we not do this in? Can't do this in California. Can't do this in New York. Not that you can't get paid, they just take too long to pay. Can you do this on HMO? I don't recommend it. Can you do this on capitation? We don't recommend it. How does this interact with your MIPS score? And how does this interact with your annual wellness? You're going to have a huge 30-page report in your chart, and it's going to dramatically, and you're going to have fulfilled every criteria for MIPS that there is. Because one of the criteria is, do you do pulse oximetry? You're going to have fulfilled that. One of the criteria is, do you measure BMI? You're going to have fulfilled that. Do you do waist to hip ratio? It's going to be there. You're going to have about 50 to 70 additional points than what you need for MIPS scoring to maximize. So it'll help your general practice as well. If you do HEDA scores, it'll definitely help that. As in terms of deductibles and copays, we follow whatever you currently are doing. So if you don't collect deductibles and copays, we understand that because you're dealing with a patient population that may not be able to afford it. So we will comply with that and not charge you anything on the deductible and copay component because you didn't collect the money. Now, if you do collect deductibles and copays, then we get our 40%. As in terms of responsibility in a zero payment situation or reduced payment, our payment gets reduced or you don't pay us at all. Timeline on implementation, it's taking us about 3 months to get a practice situated and rolled out and get people hired up and getting the practice to collect money. It takes about 3 months. Your responsibilities are to work with us to develop standing orders. We do put the equipment in your office, so you have to name our equipment as an additionally insured on your insurance policy for your equipment because it's $100,000 of equipment, and in case somebody breaks in or something, we want to make sure that we're also named on your policy. But you're not insuring our staff, and you're not paying for our staff. The equipment is upgraded about every 2 to 3 months, but we have to physically come to site to upgrade it. Our AI, we don't let it talk to through the internet because we believe that that's a contaminant that we don't want to take a risk on.